A city of 29 million people, eerily quiet. But the calm on the streets of Delhi, deceptive. Inside hospitals, harrowing scenes, an explosive surge in COVID-19 infections pushing the health system to breaking point. As cases soar, an acute shortage in oxygen, medicine and hospital beds. Outside, a long queue of ambulances wait with critical patients inside. The sick rushed from one hospital to another. Finding an empty bed, a devastatingly difficult task.
Delhi's health system is now incapable of accepting patients in large numbers. We fear that if we don't have a lockdown now, there are chances of a bigger tragedy. We don't want to be in a situation where people are dying in the streets.
The 6-day lockdown imposed as India recorded more than 250,000 cases over 24 hours. The speed of spread staggering. Scientists say a new double mutant variant may be contributing to the skyrocketing infections. The age bracket of those suffering severe illness widening.
There are younger patients who are being admitted into hospital and are more sick than the type of disease that young patients usually have, which is mild to moderate.
In the state of Maharashtra, home to financial hub Mumbai, which is also in lockdown, oxygen tanks are ferried in. The region, which represents 1/4 of India's total infections, also grappling with shortages. Data suggests almost 1,800 people died overnight, but mounting evidence suggests the death toll is being grossly underestimated. Several major cities are reporting far larger numbers of cremations and burials than official figures. Crematorium workers say metal parts in some furnaces are beginning to melt because they are operating around the clock. Vaccinating India's population of 1.3 billion, a mammoth task and one that is already behind schedule. Warnings India's failures could have global implications.
Every time that we have a mutation, we're worried about increased transmissibility, increased threat of death, and a lack of ability of our vaccines to work.
And it's feared India's deepening health crisis could get worse. The lockdowns forcing migrant workers to head home to rural areas which are ill prepared for an influx of the potentially infectious.